Good morning, everyone, and thank you for joining me here today, along with Dr. Sunil Sookram, Alberta's Interim Chief Medical Officer of Health, and Dr. Ifoma Achebe, Medical Officer of Health for the Central Zone with Alberta Health Services. As of noon on Friday, we have a total of 210 cases of measles in Alberta, of which 26 are still communicable, which means that they are able to transmit the virus. The vast majority of the 210 cases are in the south and central zones, with a total combined case count of 178. What is concerning is that 179 of the cases in Alberta are impacting children under the age of 18. As a mother and a grandmother, I feel for the parents and guardians of those children as they watch their children deal with this horrible virus. I want to say that we are with you and your children. Should they need it, they will have the best of care with our amazing doctors and healthcare professionals right across the system. And just a reminder that all children ages 6 to 11 months are now eligible for a null dose, which is a mini booster, if traveling outside of Canada or anywhere in Canada or Alberta where measles is spreading. Alberta's government has been monitoring the situation very closely, and we've been working with our public health officials and following their expert advice on the situation. But there's one thing I want to make very clear. Getting immunized against measles is the single most important thing you can do to protect your loved ones and yourself and your community. Especially those young infants who have just come into the world and aren't able to be immunized, as well as pregnant women and those with certain immunocompromising conditions. As of April 26th, almost 90% of all cases were confirmed in Alberta. As of April 26th, almost 90% of all cases that were confirmed in Alberta were unimmunized. It's vital that we all do our part to protect vulnerable groups by staying up to date on immunizations. If you are unsure of what your current immunization status is, please visit alberta.ca to find out how you can check your immunization records and determine what immunizations you might be eligible to get. Thanks to the work of our public health teams and ongoing communications with Albertans, impacted communities, there has been an overall increase in immunizations for measles right across the province. If I could just grab a Kleenex really quick. I've got something. I apologize, everyone. I have contacts on and I've got something in my eye. My apologies. Do you have one? Perfect. Thank you. Okay. My apologies for that. So as I was saying, we are seeing that immunizations are increasing right across the province. And for example, between the weeks of March 16th and April 20th, 32,302 vaccines have been administered, which is a 67% increase from the same time period last year. While this is encouraging news, there is still work to be done. That's why, starting today, access to measles immunizations is being expanded even further at Central and South Zone clinics with the hope that it will speed up the process of getting immunized so that so many more people can be protected quicker. Measles is not a mild illness. It's highly contagious and could lead to serious complications, particularly for children under 5 years of age and vulnerable individuals. So the measles vaccine is highly effective at preventing infection and complications and has a long proven track record of safety. That's why next week we will be launching an expanded advertising campaign to help get the information out to Albertans in a much broader way. So right now we have a social media campaign underway that encourages Albertans to check their immunization records to ensure that they are protected against measles. And while this campaign has been successful, we realize we need to do more. And that's why we're preparing to launch a broader campaign in the next week or so that will include radio, print, digital, and expanded social media advertising. The campaign is simple. Don't get measles, Get immunized. As part of this campaign, we're developing a toolkit for daycare providers to help ensure parents have the information they need to protect their children. We will have more to share on this and have plans to communicate with childcare operatives when the toolkit is ready and where they can find it. To help reach as many Albertans as possible, the campaign will be transmitted into over 14 languages. Online ads will be available in French, Chinese, Punjabi, Spanish, Ukrainian, Urdu, and Tagalog, while radio ads will also include Arabic, Hindi, Korean, Farsi, Somali, Vietnamese, and also Low German. Our hope is that this awareness campaign increases immunization rates and makes sure that Albertans have the access to information that they require. As well, starting on May 5th, HealthLink 811 is introducing a dedicated measles hotline. Albertans seeking information about measles can fast-track their campaign through HealthLink by calling 1-844-944-3434. Again, that's 1-844-944-3434. The measles hotline will speed up access to a professional who can assist with accessing your immunization records or general information. That line will also be able to provide advice for those experiencing measles symptoms or are feeling unwell, and can assist with booking measles immunization appointments or locating a public health clinic offering immunization in your area. Alberta's government is taking every possible step to further bring measles under control. And I want to thank the teams of public health officials for their ongoing hard work and responsiveness to those outbreaks, and especially the two doctors that are here today. So this work includes adding additional immunization appointments to support timely access, increasing public awareness, and working closely with healthcare providers to ensure that they are prepared to respond to measles cases that may present for care. And of course, also all the work that they're doing to protect all Albertans. I want to remind Albertans to be diligent. If you develop symptoms of measles, please stay home. In addition, please call HealthLink or 811 before visiting any hospital, clinic, physician, nurse practitioner, or pharmacy for further direction. Alberta Health Services has been providing regular updates on the known public measles exposures, as well as often providing updates including health care facilities that have been affected. You can also visit the website at alberta.ca/measles for more information, and that's updated daily, Monday to Fridays. It's very important everyone check their immunization records and gets immunized if you're eligible. If you are uncertain of your immunization history or your child's immunization history, text vaccine record to 88111, call the new measles hotline, or your local public health office. Albertans can also text measles to 811 to get measles health information texted to their mobile device. So as you can see, we have many ways that we are getting the information out to Albertans. So with that, I thank you for being here, and I'll turn it over to Dr. Sookram for more information.
You're going to have pity with me. This is my first time doing this. So. Thank you, Minister. Good morning, everyone, and thank you for being here. I want to speak directly to Albertans today about this growing public health concern. Measles is spreading right here in Alberta. At this time, we're looking at the highest number of measles cases in the province in decades. This is a disease we rarely see in Canada or Alberta for many years, thanks to the high immunization rates. And I have to admit, I've been practicing emergency medicine at the University Hospital for 25 years, and I've never seen a measles case in my career. So up until now, we thought the disease had been eradicated, but things have changed. Measles is now circulating in several areas in our province, and it's quite concerning. Measles is one of the most contagious diseases we know of. It spreads easily, especially in communities or places where people gather frequently, especially indoors, or where immunization rates are low. In Alberta, we're seeing this clearly. Almost 80% of the current measles cases are in central and south zones currently. And these are areas where vaccine coverage has fallen, sometimes due to concerns about safety, sometimes due to cultural beliefs, and sometimes due to misinformation. People are living busy lives now and may have forgotten about getting vaccinated, or their children's vaccination schedule were disrupted due to the pandemic over the last couple of years. For whatever reason, the result is the same. When fewer people are protected, measles spreads and the risks go up. The complications from measles are serious. They include pneumonia, swelling of the brain and spinal cord, and even death. Measles also weakens the immune system, making people more vulnerable to other infections. The truth is this: measles affects children under age 5 years of age the hardest. Outbreaks can happen quickly in settings such as schools, sports events, places of worship, and childcare centers. One case can easily lead to many more. People that are infected with measles initially present with very benign symptoms, some like fever, cough, runny nose, and red eyes. But this is followed up by a blotchy red rash about 4 days into the illness. The rash usually starts on the face and progresses to the trunk, the arms, and the legs. The rash can spread, or the virus can spread 4 days before the rash develops and up to 4 days after the rash develops and appears. And so it can be difficult to recognize that you have measles, and yet you're still spreading it to other people. Children under age 5, pregnant women, and those with weakened immune systems are most likely to face severe outcomes. Babies under 12 months are not routinely immunized until 1 year of age, according to the Canadian immunization guidelines, and they rely on the people around them to stay safe. That's why we're acting, and that's why we need your help. As the minister said just a few moments ago, we're launching a province-wide awareness campaign. It's called Don't Get Measles, Get Immunized, which will be across all radio, print, and digital media in 14 languages to ensure families have accurate, timely information. We're working closely with healthcare providers, schools, community leaders to share the facts and offer support. We're also expanding access to measles vaccines across all zones starting today. For families with infants between 6 and 11 months old who live in and are traveling to high-risk areas, an early dose of the measles vaccine may be available. Please call the new measles hotline that the minister identified for more information. Information is also available at the alberta.ca/measles, where you can learn more about the current situation in the province. We're not here to judge or pressure. We know immunization decisions can be deeply personal, but we're here to support families with science-based information and to make sure people know where to go and what to do. The measles vaccine is safe, it's effective, and we know this to be true because, according to recent studies, it has saved the lives of over 154 million people in the last half-century. The vast majority of lives saved, 101 million, were infants or children. Measles is preventable, and the time to act is now. If you or your child is eligible for a measles vaccine, please get immunized. If you or your child is sick with symptoms that could be measles, stay at home and call the measles hotline or your healthcare provider for further direction. The measles vaccine is available, it's free of charge, it's safe and highly effective. And for those that haven't yet immunized, please know this: the risk of measles in Alberta is its highest it's been in nearly 30 years. Please follow the advice of public health and stay at home if you or someone in your family is sick with measles. Every action matters. Let's work together to protect Alberta communities, especially our youngest children who depend on us the most. Let's work together to keep measles from spreading further and to keep all Albertans safe. Thank you very much.
Okay, thanks. Thank you, everyone. We'll now open it up to questions from the media. As always, if you could please state your name and outlet, and we will be sticking to one question, one follow-up today. We'll start here in the room before moving to the phones. We'll start with Janet, and then you can go ahead.
I think this is probably a question for Dr. Sookram. Go to the mic.
Sure.
Last week, the minister was using the language of this is not yet an outbreak. Now you're both using the word outbreak.
Not a provincial outbreak.
So is
be
it
correct.
Is it a provincial outbreak?
No.
No.
Okay.
There are local areas of concern that have local outbreaks, and that's what we're dealing with right now.
Okay. Has there been any deaths as a result of this, or how many people are in intensive care right now?
There are no deaths that are being attributed to measles to date. There are some patients, some Albertans, that are in the intensive care setting currently.
Number? Do you have a number?
I'm not sure if I'm allowed to say that from confidentiality standpoints.
Well, I think you could give a number. We
Oh.
just won't identify individuals.
Okay.
Yeah.
As far as I know, as of the weekend, there were 3.
Okay, thank you. Go ahead.
Lisa with Global Edmonton. What has the cooperation been like in the communities? I have heard that it's some communities that might not, like you say, believe in vaccines or have enough knowledge. So can you expand on the cooperation within those communities that have been hit the hardest?
Yeah, okay.
Sure. Thanks. Based on what we see in Central Zone, there's been some cooperation with the communities that are affected. Usually when we see a case, we identify the contacts and follow them up. If they're within the days range for immunization or immunoglobulin, we offer that to them. The cooperation level that we see is, it's really not, it's not unexpected. This is not the first time we're doing this kind of job, but I can tell you that we're getting some cooperation, sometimes we don't. So it's not anything that is really peculiar to my part of the province. Yeah.
And this question would be for LaGrange.
Sure.
Can you give a ballpark amount of what a campaign like this is going to cost? And in hindsight, was the province kind of thinking that if they, spoke more about it or drove home to get your vaccine earlier, could this campaign have been avoided?
Well, we've been ramping up our campaign right across the province, whether it was for influenza, RSV, COVID, including measles. As measles became more evident across the province, we were targeting those areas. It's the reason we're also making sure that the campaigns are in 14+ languages so that we can reach various communities. It's just as more is needed, more has to be done. So we're just wanting to make sure that we're not leaving any stone unturned in terms of reaching the people that need to hear the message. So I don't have a ballpark figure on the cost of the campaign just yet, but I know that typically we are spending many dollars to make sure that we're getting vaccination information and immunization information across the province. And, that's in addition to what we normally would spend every year and the amount of work that we do within our school systems and in our communities. Huge shout out to our public health nurses that are constantly meeting with families and communities, and healthcare professionals that are constantly meeting with families and communities that are most affected, because it is the unimmunized and the under-immunized that are most affected, particularly by measles.
Okay, thanks. We'll now move to Catherine, and then you can go after.
Yeah, so Catherine Petrowski, Alberta Today. So can you explain a bit more, because there are some communities who aren't on social media or online. You mentioned you're expanding those campaigns. So what are you doing for outreach to those communities that may not be online, might not have the community paper?
Well, again, reaching those communities in ways that they, that they most are appreciative of, in terms of having trusting relationships. So those individuals that they trust, whether it's their community physicians or their healthcare nurses, other individuals, speaking with their faith leaders, etc. For some groups is very effective. So it is really, I'll turn it over to Dr. Achebi very soon here to expand on that. But it really is, how do we develop trusting relationships with those communities that are under-immunized or are unimmunized, how do we get the information out? It's, as I said, reaching them in their own languages, developing those trusting relationships, having those conversations, and as Dr. Sookram said, not being judgmental, but really just going in with the information and the science and helping them through the process. Dr. Chebby, if you'd like to expand.
Yes, so in Central Zone, for example, we've been reaching out to these folks through their leaders. We've also been sending up-to-date information to the communities and also to physicians or healthcare workers working in those areas. We've also been sending information to schools where some of these kids attend. So we've been working very closely with education in those areas, principals, superintendents, community leaders, and physicians and other healthcare workers.
If I may add, the medical officer of health teams of the various regions know that the boots on the ground, they know their people and their communities, and they've been out engaging them as much as possible.
And this was a disease, as I said, we thought it would have been eradicated. So what is that vaccination percentage threshold that we need for herd immunization or community immunization?
Take that. So for us to achieve herd immunity, we need to have 95% of the population immunized to prevent further spread. Unfortunately, we're not there yet. In my zone, for example, we're at 90, like in Central Zone. And then in northeast area of my zone, where we're seeing cases, we have about 72%, which is not very ideal. So that's why we're seeing some cases there, and that's why we're taking these measures to promote immunization.
And if I could add to that, just briefly, we are seeing those immunizations climb. As I said earlier, we've got about 67% increase in immunization from the same time last year. Right now, by the age of 13, approximately 90% of 13-year-olds have both doses of the measles vaccine, and by the time they reach 17 years of age, that is actually 93%. As Dr. Chebby said, we need to get 95%, so we're almost there, but again, we need to see that right across the whole province.
Jack Farrell with the Canadian Press. My first question, just following up on Janet's, what's the threshold for it to be determined like a provincial outbreak? Like what is the threshold to hit there that we call it that?
Well, we would have to see cases in every zone continuing to climb, and we do not see that across the province. In fact, Calgary zone and Edmonton zone have been down to roughly about 5 cases. They've been at that since pretty well the beginning. And that's all of Edmonton zone, all of Calgary zone. We have started to see, I think there was one case in Calgary zone on the weekend. So, but we have not seen that right across the whole province. North zone also has been relatively low. The hot spots right now are really central and south, where we're seeing double-digit increases.
And then my follow-up is for Dr. Sookram. You are obviously new to the role here as our Chief Medical Officer of Health on an interim basis, but how long can we expect you to stick around? Would you want to be the permanent CMOH?
No, my wife has told me no. I am trying to be a good citizen. I serve in government as a part-time role. The minister asked me to step up because there was a need. I'm stepping up, and I'm trying to my best to lead the team. And when the permanent person is found, I will step down.
Okay, thank you. We'll go to one more question in the room before moving to the phones. James, go ahead.
Hi, James from the Western Standard. You've talked about this as a concern. Why not just call it an emergency right now? And what is the number of cases that you would need to see in order to declare an emergency?
Again, we would have to see ongoing increase in cases in every single zone, and we are not seeing that. So it is, again, still very localized. And also within the zones, it is, for the most part, localized to certain communities and certain areas, as Dr. Chebby has already indicated. So we would have to see that more widespread before we would call that a province-wide outbreak.
Do you have a follow-up, James?
Nope.
Okay, we'll now move to the phones. Operator, please put through the first caller.
Your first question comes on the line of Christy Kirkup from Globe and Mail. Please go ahead.
Hi, good morning. I'm wondering how challenging is it to get out a public health message about measles amid the uptick in medical misinformation predominantly shared online?
Well, obviously, we're making inroads because we've seen a 66 or 67% increase in the number of immunizations that have occurred just over the last month and a half or so in comparison to last year. That being said, has been said, people live very busy lives, and unless it affects them, sometimes it is hard to hear the message. I do believe we're having success because we're seeing that immunization rate increase, but also making sure that we can reach people where they're at in the language that they understand is also very important. It's why we're stepping up our campaign even further. I'm not sure if there's anything you would add to that.
Well, we've been doing a lot, like the minister mentioned. In Central Zone, we've actually seen a 50% increase in immunization in April compared to the previous month. So even in the previous 2 months, it's increasing, and we hope that with this campaign kicking off, that we would get some more.
Do you have a
I
follow-up?
think the other thing I would add is that even though we've increased hours of clinics, we're now increasing the number of clinics. We're just trying to make it as easy as possible. If anybody wants to immunize themselves or their children, that they have access, easy access to those clinics.
Do you have a follow-up, Christy?
Yes, please. We know that measles is making a resurgence not only in different jurisdictions in Canada, but also worldwide. And so I'm just wondering if Dr. Sookram has any thoughts on what are the contributing factors to this resurgence in measles domestically and globally.
Great question. I'll turn it over to him in a second. I do want to highlight the fact that the initial cases that came into Alberta, 2 were from international travel, and I believe 1 was from a travel in Ontario. So we are seeing them coming into the province. They did come originally from outside. So I'll turn it over to Dr. Sookram.
So immunization is such an important part of our culture, our lifestyle of growing up. And unfortunately, we got complacent, I guess a bit. People forgot the importance of vaccination, and it allowed these diseases to reemerge. It's sad, but I think it's a good reminder of how important immunization is in helping protect Canadians and Albertans in some of these diseases we thought were eradicated. And so please, I urge all of you to review your own immunization records, those of your family members, and to go get immunized. There's measles today, who knows what the next one will be. So please use your relationships with your family doctors, your nurse practitioners, your care providers, the public health system to protect yourself and your families.
Okay, thank you. Operator, please put through the next caller.
Your next question comes from the line of Mario Cabradilla from Great West Media. Please go ahead.
Good morning. This is for Dr. Ifeoma Tebi. 13 cases of measles have been reported in the Two-Coast area in April. April. Has the situation stabilized, or have you seen increased cases, or or are there still active cases being monitored?
Oh, so for that area, we've been seeing cases since March. It's for most of the cases that we've seen in Central Zone are from the northeast area, so that's the Two Hills Vegreville area, and that's at Friday we were at 72, so that number has increased.
Do you have a follow-up?
No follow-up. Thank you.
Okay, thanks. We have time for one more question. Operator, please put through the next caller.
Your next question comes from the line of Jennifer Lee from CBC News. Please go ahead.
Hi, thanks for taking my question. This one is for Dr. Sookram. I'm wondering if, given measles is just so highly contagious, what are the province's plans in terms of, for example, standalone assessment clinics? Are those in the works? Are there some operational? Can you give us a sense, sort of an overview of where that is at, if you see that as being necessary? And if so, where are you looking at putting them? When will they be operational? That kind of thing.
First of all, Jennifer, I'm a big fan, so I read the CBC, I read your articles. So with respect to your question, we have started conversations about measles assessment and treatment centers. AHS and the ministry have been working together to fine-tune that plan. When the threshold has been met to implement that plan, like we've done for influenza, like we did for COVID, and there's a need for that service in particular, I think we'll be prepared to launch that.
Do you have a follow-up, Jen?
Yeah, I do, thanks. Can you kind of give us a few more details about what the threshold for that is? And then just sort of to follow up on that, given what we're seeing in places like Ontario and the spread there, and the increasing numbers we're seeing here that, the case counts daily have been increasing quite significantly over the last little while, what is your confidence that this can be reined in? Or do you expect that we will see a situation similar to what they're seeing in Ontario?
Those are good questions. With respect to the threshold, I think we will work with our operational partners within Alberta Health Services to find out when the resources of extra facilities, measles assessment treatment centers, are required, and then we'll implement it at that time. So we're having the conversations, we're building the plan, and when we get the advice that that is what's required, we will certainly launch that. With respect to the growth of the disease, we are now taking active steps through immunization programs to try and stem that growth. It'll take a couple of weeks to months to see the fruits of that effort. It's not a quick thing, right? The immune system is complex, and when I was in medical school, that was the hardest part of medicine, learning how the immune system works and its complexities. So it'll take a while, but I'm hopeful that the steps we're taking now will bear fruit in the near future.
Okay, thank you, everyone. That's going to conclude our press conference for today.
Thank you.